response to this impromptu press availability. But we've been getting so many requests, the Attorney General, the leadership, and myself, for an opportunity to talk about the process and where we're going with the health care bill, that we thought it would be much easier just calling this conference, asking the leadership to join us and begin it. And begin it. So I think most of you know it was already announced as President Obama signed the bill that the Attorney General, Bill McCollum of Florida, at that point in time signed the papers to begin the action against the Department of Health and Human Services, the Department of Labor, and the Department of Treasury to try to stop the implementation of the so-called health care reform bill. He was joined by 12 other states, including the state of Idaho. I wholeheartedly applaud those efforts, and will, with other governors who've already been announced, continue to pursue whatever relief that we can get at the state level. I'm going to ask Attorney or General Wasden to, if you will, just kind of briefly outline for the constitutional provisions at which we're pursuing.
Thank you, Governor, and I wanted to thank the House, the Senate, and the Governor for providing some guidance and direction in this over the last few weeks. We appreciate their input. We did join the lawsuit, which is filed in the district court, federal district court in Florida. We do have a couple of questions that we think are significant and need to be answered by the judicial branch of government. Among them, whether the United States Constitution has granted to Congress in the Commerce Clause the power to compel citizens to purchase health insurance. That is, in our view, an extension of the commerce power beyond what we have seen in the past, and believe that this question needs to be posed to the United States Supreme Court ultimately to answer that question of whether the Commerce Clause extends that power to Congress. So that's really the heart of this lawsuit. There's an additional issue with regard to state sovereignty, which is, does Congress have the power to impose additional costs on states that is really counter to the agreement we had with the federal government with regard to certain Medicare recipients in the past. So we'll find the answers to those questions. We have to wait to find out what the court's going to say on that subject. That's really what I have, Governor. Thank you.
Great. What's your, anybody else have anything you want to say, Jim? Okay, well then let's open it up.